Hello, dear mommy. I just your kid. I understand that you're going through a lot. We live in an era whereby a woman is expected to be a homemaker, be a provider, while looking demure and catty, and that is extremely impossible. We live in a world in an era whereby money is making the world go round. We live in an industrial era, and there is no village yet. It takes a village to be a woman. So I'm sorry, Pepisa. It will be okay. It will be okay. So today, the Spirit led me to talk about birth. I don't know why. Maybe there is somebody who needs this urgently. But the sad part is, with the constraint I have with data, I still have to post other videos before posting this one. So I don't know, but the universe, I trust the universe, I trust source, that this video will be posted at the right moment, at the exact moment, whoever is channeling this needs it. Right. So I want to talk about giving birth. Right. So I experienced both processes, so I'm going to talk about both in this video, because I feel like this is an emergency for whoever needs this thing. Okay, let's start with the natural birthing process. Right. So labor. Okay, when the labor sets off, you just feel it. It's no rocket science, really. With my first child, I thought maybe I would have to ask that, is this it? Is this it? Is this it? Right, you will just know. With some people, the water will break, though sometimes it's a gush of water. With both my children, it was never a gush. With my first, nothing came out, nothing at all. But with my second, I was just dropping. They were just dropping like secretion, but a high amount of secretion, dropping regularly. I just couldn't stop. I had to wear a sanitary towel to stop, to prevent making a mess. So yeah, that's the first step. With some people, it's just the onset of this. I don't know. It's not pain per se. I don't want to say it's pain, because it's not pain. It's a feeling that just tells you to go. Right? But you will know, your body will tell you, because your body is this biological intelligent machine which works harmoniously to tell you what it needs. If you just listen to it, you will know. You will know. Nobody has to tell you anything. Your body knows, and it communicates with you in a way that you will understand. Whether you want to understand or not, you will definitely understand. There won't be any questions. All right, so you will feel this is called labor. So labor may last from a few minutes to hours and even days, depending on your body. Just listen to your body and know when you're supposed to go to the hospital. Maybe sometimes this will feel extremely intense, so it's better to err on the side of caution. Just whenever this feeling starts, just rush to the hospital and let the healthcare providers take care of you. So when you get there, they will tell you when you're ready or not, depending on your dilation. Right, when you are there, they will tell you that, okay, you're dilated. So work with them, because sometimes people are different. With my second child, at 4 centimeter dilation, I was ready to push. Okay, it started to rain, so I had to shift. So at 4 centimeter dilation, I started to push. Yet it is known that at least 6 or 7 centimeters, that's when you're ready to push. So work with the healthcare providers, communicate with them. Right, work with them. Just work with the healthcare providers. Don't be afraid. This is your body. This is your life. In as much as they know how it should work, but bodies are not the same. Everybody is unique. Right, so work with them. Tell them what you're feeling. Tell them what you feel like you need to do. Tell them what your body is telling you. So work closely with these people. They are there to help you. They are not there to detect to you. They are there to help you. So lean on them. When your body tells you to push, nobody will tell you. You will know. You see the amazing nature of the body. The way the body works is truly amazing. Truly, God, the supreme being, source, the universe, made the body to be extremely amazing, to an extent that it's this powerful machine nobody can comprehend. Right. So when it's time for you to push, again, please and please work cooperatively with the healthcare providers. Communicate with them in a respectful manner, and they will respect you back. What most women do is they listen to this. I don't want to call it pain because it's not really pain. You see, when you have an extreme tummy bug or diarrhea, the tummy is, it's not really painful, it's just twisting. It's like they're twisting knots in your tummy. It's not really real pain, it's just knots twisting about in your tummy. So you feel like, if I can just run to the loo and take out this diarrhea, then I'll be okay. It's the same feeling you have with labor and delivery. You feel like there's just this knots twisty, and if I can just push it out, and I'll be okay, I'll be relieved. So that's how it feels. So it's not really pain, it's just these knots. It's the urge to push, right? So work with the, whenever you feel like you need to rest, just tell her that, okay, I feel like I need to rest and breathe. Is that okay? Then she'll advise you that, okay, breathe, I will help you in this manner. Don't just keep quiet and just, there's a breathing. No, don't do something you feel like. Yes, listen to your body, but communicate with the person who's helping you. Communicate, tell them what your body is saying. Listen to your body, then tell the person who's helping you, okay, my body is doing this. How should I tackle this thing? Then they'll tell you that, okay, wait, you can breathe right now, so I'll be doing this while you're breathing. Oh, wait, don't breathe right now. If you breathe right now, you may crush the skull. Or if you breathe right now, something, you see. So work cooperatively with the healthcare providers, and then push. And when you're pushing, people don't really give you this information. I was lucky to get it. I was just browsing through my application, tracking my baby's growth, and I just saw a comment that says, I was so shocked. I'm quoting the comment now. I was so shocked that it was easier taking out a baby when you are pushing like you are taking out one hell of a shit. Right. So I think this is a tip I'm going to give you. Don't push like you're pushing out through the vajayjay. Push like you are taking out one hell of a shit. Like you are pooping in the toilet, and this poop is extremely big, such that it needs your whole strength. So just push through the a-hole. Don't push through the vajayjay, or else you will tear hard. Push like you're pooping. And yes, you'll poop. Believe me, you will poop, and that's okay. That's part of the process, because this is a whole human head coming out through the vajayjay. So yes, it's pressing against all these excretion points. So yeah, don't worry, you'll poop, and the healthcare providers know, and they're okay with it. Don't feel embarrassed or hold back or whatever. Just push it out, right? So that's it. I will come back to postpartum in another video. Today, let's just deal with these birthing processes. And then we come to C-section. I'll also tackle what needs to be done before delivery, but today I feel pushed to just tackle delivery. I don't know why. And I'm a person who is spirit-led, and I listen to spirit. I never question why spirit is giving me information. I just tackle it as it comes, because I know that it's an information that is either urgent or extremely needed by the collective consciousness. So now we're coming back to C-section. Okay, with C-section, it can either be planned or an emergency C-section. With the planned C-section, you go prior. You go maybe at 3 months to arrange it, and your doctor will know when the date will be set. By the way, you don't have to wait for labor. They'll just set a date way before your delivery date. So you have to go there before labor, and then they just do the operation, and bam, done. I will talk about postpartum in another video. And also, you should not eat for at least 8 hours before the procedure. I think that's what the doctor will communicate with you beforehand. In fact, the doctor will work with you before and after the C-section. And with the emergency C-section, this is done during labor. Maybe you went there to push, and you find that the baby maybe is oblique or transverse, or maybe the umbilical cord is in a compromising manner, or maybe you've lost so much blood, or maybe you are inadequate, or any other thing, any other complication that maybe is putting the mother or the baby at risk. Right, so it will be an emergency C-section. So you'll sign some consent forms and just put your trust in your God, and the healthcare providers, right? It's not a very complicated thing. It's not a life or death kind of thing. It's so easy peasy if you just relax. Just relax. Yes, you might have eaten, but the healthcare providers will know what to do in line with the food in your tummy. What you have to focus on is getting this baby out healthy and coming out coming out healthy. So what happens is you sign these forms and you're taken to the theater, and everything is just taken care of. Just relax and put trust in the healthcare providers. They will just form an incision in your abdomen, cutting through the uterus, and they just take out the baby manually. And you won't feel a thing. You'll be awake most of the time. Most of these C-sections that are done nowadays, you're just wide awake, but you can't feel anything. They just do the operation and you can't feel anything. I'll come back with the postpartum in line with all these delivery methods. But with the C-section, it's just easy peasy. Just put your trust in everything and just trust that everything will be okay. I can't help but notice that I didn't do much justice with regards to the C-section. Okay, so with the C-section, what happens is after you sign the forms, you are inserted this urine thingy whereby your bladder just empties on its own, because you remember that they are going to inject you with this anesthesia thingy. It may sometimes it's through the spinal cord. For me, they injected it in the spinal cord. It's an injection. It's not painful at all. It's just a prick. It's just a prick. Yeah, it's like a pricky feeling. It's not painful. Especially for me, I got a very, very professional anesthetic. Is it an anesthetic? Yeah, the anesthesia person. He was very, very professional and gentle. So what happened was I didn't feel any pain, and I was asked after a few minutes if I could feel anything, and by then I could just feel a bit. So they waited a bit, and then after a few minutes again they asked if I could feel anything, and then by then I couldn't feel a thing. Genuinely nothing. Zero, zilch. So then they made me lay down on this theater bed, and then covered thorax. Yeah, just below the chest downwards. They covered me with this green curtain thing so that I don't see what is happening on the other side, because you may be traumatized if you can see being cut open, right? So yeah, they insert you with this catheter thing. Yes, they insert it so that it sucks up the urine and empties it into a bag. And then this bag is very portable. You can just carry it around like a drip. And you take it into the theater with you. And when you get there, they then inject you with the anesthetic thingy. And then you get numb from the... Yeah, I think it's from the chest down, such that when they operate on you, you don't feel a thing. They cut your skin layer, your fat layer, your fascia, muscles. I don't remember how many muscles are there until they reach into the uterus, and then they yank out the baby manually, and then after that they just stitch you up, and after that it's as good as new. No scar, no whatever, no nothing. So I think I will talk about the postpartum care and all those things in another video. Today I just wanted to touch on what to expect and what not to expect. And I'll always say this: trust in the healthcare providers. Cooperate, work with them in a cooperative manner, and everything will run smoothly. Trust me. Look at me. I'm fine and well, and I had a C-section. My baby is about to turn 6 this year, 2025. She's about to turn 6, and I'm okay. I'm fine and well, and everything is okay. I just put my trust in the healthcare providers, and if I can't emphasize this enough, with these processes, put your trust in your God and these healthcare providers, and everything will just align. Easy peasy. So just relax and trust in the process. It's easy. Your body is supposed to do this. God is with you. The healthcare providers are there in the physical. Just relax, be calm, and trust in the process. You're okay. Big hug to you.